talk about a patient here that came in, and she came in because of both her feet. She was really concerned about these areas of discoloration on the 3rd, 4th, and 5th, and here 2nd, 3rd, 4th, and 5th. Now, she worked as a house cleaner. She was in shoes all the time, and she was actually so embarrassed with her feet that she never wore open-toed sandals. And I want to point out, you see how these kind of look like almost like skin color in these areas? These are hammertoes, and these are calluses. But this woman, she actually scraped them down so much, she scraped down that hard skin, and she made it this color. So it was discolored, and it had this problematic circle in the area, and she was quite embarrassed with this. And the first type of treatment, what we recommended, were a deeper, wider type of a shoe that wouldn't cause the irritation. And the second thing was to not touch her toes. Don't use a pumice stone, don't use any types of creams, just give it some time to normalize. And she came back, and what we see here is this is a normalization after a couple of months, and you could actually see what was bothering her. These are these calluses that she was shaving down, and they are caused by tight shoes. This is purely caused by tight shoes, and it could be improved by wearing either sandals or a shoe that's a little bit deeper and wider and longer. She came back in with this. Once again, told her not to do anything. I trimmed down the callus, and then she came back in again a little bit later. And I want to show you that the color actually matched her foot now. Do you see how this coloration improved? Coloration improved. She still has the calluses, okay? They're a little bit less obvious than they were before, but they're the same color and tone as the skin. So this is only by doing a shoe change, and she's quite pleased with the appearance. Now, some of the toes she's a little concerned with, specifically this one here. You see how this toe is longer than the other ones? And that really bothers her. Probably you didn't even notice it before I mentioned it. But some people have a condition where this toe is a little bit longer. We kind of make a joke in the podiatry field that if this toe is a little bit longer, it's usually because the woman, she's the one that rules the roost at home. But she really didn't like this. And there are some options for shortening this toe. If this hammer toe bothered her, we could take out a little portion of the joint here or here. That would shorten it. Be aware though when you do that, there is going to be swelling in all of the toes that you correct the hammer toe, and potentially this could be corrected because of that to shorten it down. But you can see a great improvement after probably about 6 months of wearing an appropriate shoe, and it look much better, and we can see which of the toes, or if any of the toes, we want to fix with surgery. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.